Hello, I am Georgina Vargas, and in this presentation, we will be covering carpal tunnel syndrome. Okay, so what is carpal tunnel syndrome? CTS is one of the most typical hand conditions and is usually caused by pressure on the median nerve in the wrist carpal tunnel. The carpal tunnel is a small opening enclosed by ligaments and bones found on the palm side of the hand. Repetitive hand motions, particularly those requiring flexing or extending the wrist, are frequently linked to this condition. Overall, CTS affects 1 to 5% of the population with a 3 to 1 ratio. It is more common in females than in males. Although CTS can have, although CTS can happen to any age, at any time, the chances of developing it targets individuals around the ages of 40 to 60. Just like any other medical condition, to know if one has CTS, you can look out for common symptoms that include weakness, pain, sensation of tingling, and numbness in both the fingers and the thumb, which are typical signs of this condition. The little finger isn't usually affected, but the rest of the fingers are, as shown on the picture to the left. Using the hand for extended periods of time, or more specifically during the nighttime, can worsen these type of symptoms. CTS is also associated with a lot of other factors such as anatomical aspects, nerve damaging conditions, inflammatory conditions, and overall daily occupations. How does CTS impact occupational functioning from a holistic perspective? From a holistic point of view, or in other words, considering the whole or something rather than just parts by themselves, CTS can have a big toll on occupational functioning, affecting not only physical abilities but also psychological, social, and daily functioning. Okay, so we are going to be taking a look at the holistic impact on OT functioning, particularly the physical aspect. So, with the physical aspect comes obviously pain and discomfort that this condition brings to patients or people who suffer from this. And fine motor skills can be affected by this condition, which causes tingling, numbness, and discomfort in the hands and wrists. Physical activities as simple as writing or any task require hand coordination may be directly impacted by this. And since there is a lot of pain and discomfort, excessive use and exhaustion come also with this. So repeated tasks that put constant tension on the affected region can eventually worsen symptoms and cause general exhaustion, which could affect levels of energy for work as well as for leisure activities. And as time proceeds, decreased proficiency and strength will be noticed. It may be challenging to lift, hold, or maneuver items with CTS since it can cause weakness in the muscles and poor grip strength, which has an effect on everyday tasks. Now we'll be taking a look at the psychosocial impacts of CTS on OT functioning. So as this condition affects people and it keeps going on, recurrent impairments in occupational roles can have an influence on confidence, which can lead to a low self-esteem, and it negatively can affect relationships in both professional and personal aspects. Those with CTS can turn away from social settings, which is known as social isolation, and this can make them feel alone and disengaged. Anxiety, sadness, and disappointment can result from continual pain and suffering. Occupationally, this emotional pressure can decrease motivation. Now we'll look at the impact on occupational roles and daily functioning. So with this condition, people obviously have to cope and adapt to a new lifestyle or to new manners, depending on how severe this condition can get to them. So people can look for accommodations or adaptive strategies such as ergonomic tools or adjusted routine schedules. Keeping in mind, this could also lead to feelings of dissatisfaction, which can impact how people view their occupational identity and even how they think others might view them as well. And on the other hand, and as time goes on, they're fulfilling roles. Everybody has a role that they have to fulfill on a daily or in general, and those with CTS may struggle to carry out certain responsibilities because of their condition, whether it's at home, work, or other places. As they attempt to find a balance between expectations and their restricted physical abilities, this might lead to role conflicts. So, how can OTs help improve CTS? So, to help individuals suffering from CTS manage their symptoms, restore function, and prevent further injuries, occupational therapists utilize a range of specialized therapy approaches and strategies. And they also work with patients with this condition to minimize its impact on their daily life. And as someone who wants to pursue occupational therapy, this is something that I hope to do for my patients, not necessarily with CTS, but in other aspects as well. In the next few slides, we'll take a look at some effective strategies and methods that occupational therapists may utilize to effectively help their patients. So, to begin with, there are wrist splints. Splints are designed to provide support and immobilize the wrist by reducing pressure on the median nerves. So, OTs often design and fit custom splints for their patients to best fit their needs and depending on how severe their case might be. These splints can assist with weakness, pain, tingling, and numbness, which are the common symptoms. Um, they also keep the wrist in a neutral position, and they can reduce pain and speed up recovery when worn at night or during specific activities as recommended by OTs. There is actually different types of wrist splints, as seen below. There's dynamic, volar, dorsal, or even sugar tongue. And like I mentioned, everyone is different, and depending on the severity of the case, OTs can design and instruct different types of splints for their patients. Another type of effective yet simple strategy for those who suffer from CTS is manual therapy. Manual therapy is a hands on approach used by OTs to address the functional limitations of their patients. Manual therapy basically helps relieve pressure on the median nerve through soft tissue, joint, and median nerve mobilization. This includes such things such as stretches, massages, or even nerve gliding exercises, which target the wrist, forearm, and the muscles. And it can also help lower the risk of further injuries. On the diagram to the right, we can see different types of exercises that an OT may instruct their patient to do to help them relieve these symptoms and get better. I feel that OT basically comes along with a lot of creativity, and OTs must use it in order to provide adaptive equipment and modifications for their patients. Living with CTS can truly be a struggle that has multiple effects on various aspects of one's daily lives, more in specific, like their occupations. So, supplying patients with equipment and modifications to help adapt to daily occupations can aid in reducing compression within the hands, and it can also help to lessen hand and wrist strain. Occupational therapists evaluate working conditions and suggest ergonomic modifications. These can include adaptive grips for tools, ergonomic tools, setups depending on like where people work or what they do, and other things. Another big thing that OTs can do for their patients is not only educate them but provide self-management methods for them to be able to do on their own when not being treated by an OT. OTs play a key role in teaching their patients how to treat CTS on their own through proper education on their condition as well as adequate self-management methods. So, in the education on CTS, OTs can thoroughly describe the wrist anatomy for a better understanding to their patients, just to let them know how exactly things work within the wrist and so they can have a better understanding overall. They could also discuss potential factors that can contribute to CTS just for the patients to be more aware. And they can also assist patients in identifying early signs of CTS to prevent further damage. Once one knows that they have CTS or may have potential of having CTS, OTs can provide them with self-management methods that they can do on their own. So they help their patients determine the activities in their daily occupations that may be making their symptoms worse and provide changes that decrease the pain. For example, taking breaks, utilizing ergonomic devices, and alternating tasks can be really helpful for this. And they can also introduce pain relief methods such as exercises or even medicine and teach relaxation techniques to them. Some major takeaways from this small presentation that we learned is that CTS is a common condition where there is pressure on the median nerve in the carpal tunnel. This leads to symptoms such as discomfort, tingling, weakness, and numbness, which is something people can look out for. Thankfully, occupational therapists play a crucial role in the treatment and recovery of this condition, and they help in lessening wrist pain. They offer their patients education on this condition. They suggest ergonomic changes, teach useful self-management techniques, and present adaptive equipment to them. And through a holistic patient-centered approach, occupational therapists play a crucial role in alleviating the symptoms of CTS, enhancing recovery, and promoting long-term management of their condition. These are some of the references that I used for this presentation, and thank you for tuning in and learning a little bit about what carpal tunnel syndrome is, how it affects people, and what OTs can do to help their patients.